A farmer bursts in, carrying his son. Gasping for air, Dr. Elena acts fast, performing a risky, life-saving procedure. Dr. Elena Varga's tiny rural clinic had no operating room, no imaging machines, and no backup staff, just her, a weather-beaten stethoscope, and an old metal cabinet of supplies. On a freezing winter night, a frantic knock shook the door. A farmer staggered in, carrying his teenage son. The boy's lips were blue. Pulse thready, he'd been kicked in the chest by a horse hours earlier. His blood pressure was plummeting. Elena suspected cardiac tamponade, deadly fluid crushing the heart. The nearest hospital was 3 hours away, and the snowstorm made even that impossible. She had never done an emergency pericardiocentis outside a sterile room, but there was no choice. Using a flashlight wedged between her teeth, she guided a long needle into the boy's chest, feeling for the subtle give that meant she'd pierced the pericardial sac. Dark blood filled the syringe. Within minutes, his pulse steadied, his lips pinked. He coughed, looked at her, and whispered, "Thanks, Doc." 2 days later, the snow cleared, and they got him to a city hospital. The cardiologist shook his head in disbelief. That was textbook perfect, he told her. Elena just smiled. Sometimes, in the middle of nowhere, you don't have the luxury of miracles, you make them.